are now going on to talk about thyroid disorders, and today our doctor is Dr. Eugene Tete Wayo, and we have Mrs. Nana Adra Kunedu Jani, who is president and founder of the Thyroid Gland Foundation. Thank you for joining us, ladies and gentlemen. I'll talk to you, Doctor. Tell us about thyroid disorders in general.
Okay, good morning. Thank you for the opportunity to be here. So thyroid disorders generally would include anything which affects the structure and then the function of the thyroid gland. I'm sure once you mention thyroid, you know what the thyroid gland is. A gland which produces hormones and which has numerous functions in the body. So the thyroid gland is a gland that is located in the anterior aspect of our neck, and it's a small gland, just about a finger breadth by half, and it's usually not seen until there's a problem with it. So thyroid disorders typically involve anything that affects the structure and then the function of the gland. Now the commonest problem or the commonest disorder with the gland would be an enlargement of the gland, which would appear as a swelling in the anterior aspect of the neck, and is typically called a goiter. And so you see most people walking around. That's not to say any anterior neck swelling, any swelling or any form of swelling in the anterior aspect of the neck is a goiter. But most people who would have a swelling walking about without any problem, a swelling in their neck, or some fullness over there, usually will have their thyroid gland enlarged, and that is typically called a goiter. So that's the structure. When it comes to function, like I said, the gland produces hormones, and the hormones, one of which is called thyroxine, and the other which is called liothyronin, and they all have functions they have important functions in the body. In the fetal life and early childhood, they help with they help with brain and bone development. Post childhood, they help with the pubertal. They have functions with regulation of pubertal, so functions related to menstruation and whatnot. And then in the general, function of the body, metabolic functions, cardiovascular functions, and on and on and on. So when the gland is under functioning, it's called, we say the gland is hypothyroid, or when there's, we have a low level of the hormone which it produces for the functions which it produces, and we say the gland is hypothyroid, or there's hypothyroidism. And when you have an excess of the hormones which it produces, or there's excess, you have an over function of the gland with clinical manifestation that is known as hyperthyroidism.
So let's narrow down the conversation to goiter, as you have already rightly mentioned. Can you give us some of the symptoms? What should you look out for if it's building up?
Yeah, so goiter essentially is a fullness or enlargement of the gland. So and it's usually without, so what we say symptomatic. So you find an individual who certainly will start noticing a fullness or a growth, developing in the anterior aspect of the neck. And that's it. It will be asymptomatic, or to be without symptoms until it starts giving problems. And some of the problems usually will be mechanical. So once it's asymptomatic and it's not producing any clinical manifestation, the only initial, the only initial problem will be the cosmetic. Everybody has a neck without the fullness. So once all of a sudden you have a fullness in the anterior aspect of your neck, unless of course you are not bothered, but that is one of the main problems that to present with. Then as it grows, it enlarges. It will have, so just behind the neck you have the swallowing, you have the passages for food, you have the passages for air. So if the gland enlarges and it grows beyond where it can be contained in its space, then it will have an effect on, or it will cause problems with swallowing of food, which we call dysphagia. You have problems, you may have hoarseness because then it blocks the passages for air, which helps us, to phonate and to speak. So we have problems with, breathing, and then on and on and on until it starts overproducing. That is, if you are looking at the hypers, it starts overproducing the hormones, and then the other clinical manifestations result.
Doc, I'll come back to you so we talk about the causes and treatments, but let me come to Nanaja. Nanaja, you have a foundation. You are the president and founder of the Thyroid Gland Foundation. Tell us a bit about it.
Okay, so the Thyroid Gland Foundation was founded last year. And then our main focus is to create awareness of thyroid disorders because I had a thyroid disorder last 2 years and which almost took my life. So after I was diagnosed and treated, then I decided to found a foundation to basically create awareness about the thyroid disorders because I realized that even among a lot of health professionals, it's not so commonly known. Because detection of mine took about 7 to 8 months before it was seen. Because mine had there was no swelling. My neck didn't have any swelling there. So it was difficult. I had a lot of issues. I lost weight. I lost my color. I became very dark. And then I lost weight for about 25 kilograms.
Wow.
Yes. So prior to that, I was wearing size 18 dress, and I became size 8. So that was when it occurred to somebody that, oh, let's do the test and see, because there was nothing indicating there that there's a swelling somewhere. So clinically, if you go to a hospital, unless, as doctor said, there's a swelling there, that somebody's mind may go there. But once there's nothing there, they will look out for other possible things, like probably is it high cholesterol, is it what is causing. They'll look out for maybe do you have a liver issues. So if they had to do all those lab tests
to find out what is causing it.
So after they had done everything and they couldn't see, that was it. Before somebody said, okay, let's do the thyroid function test to see if it was, and then lo and behold, it was very high. So I had to start undergoing treatment. Yes. So it was after that then I decided that I should found a foundation to create awareness, because even if in the health professionals, it's not something that clicks for someone to look out for, then let's create awareness so that if I come to hospital for a long time as a patient, I could say that, doctor, I heard that there's something called thyroid disorders.
Right.
Could you please check me for if that is what it is? So that is basically what the foundation is doing. And also we are advocating for getting affordable treatment for patients who are affected by it.
So far, have you been able to help patients?
Yes, we have.
We
have, yes. The major achievement now is we've been able to get one of the biggest laboratory in Ghana to give us a discount, because the lab test is very expensive and health insurance doesn't cover most of the labs that we do, because it's above 100 cedis. So health insurance, so we've been able to get the biggest lab in the country to give us 10% discount on any lab that we do. So we are still counting on the rest to also come on board.
I'll come back to you, Nanaja. Doctor, tell us what will cause any thyroid disorder, specifically goiter, because just like Nanaja said, she wasn't seeing it out there. So she was just reducing weight, losing her color, her form and shape, but she didn't know what was happening. What are some of the things that can cause the thyroid disorder, specifically goiter?
Okay, so in Ghana here, in Ghana, since we're talking about in Ghana here, the commonest cause of a goiter or the enlargement of the thyroid gland would be iodine deficiency. The reason being that the hormones which the gland produces needs iodine, which is a micronutrient found in our diet, for the elaboration, for the production of the hormone. So iodine deficiency is a commonest cause, and in areas where there's dietary deficiency of iodine, you would find a lot of people with goiter there, because the control mechanisms which in the body which causes the thyroid gland to produce the hormones will be an overstimulation of some sort, and so will cause the gland to enlarge just to make enough hormones to meet the body's needs. Again, you have certain substances we call goitrogens, which may stimulate they may be found in food, or it may be found in certain things which are consumed, and so will cause, in certain areas where this will cause the thyroid gland to enlarge or to become big, or for a goiter to result. Having said that, not all cases of a goiter typically is associated with iodine deficiency. You may have certain conditions where certain inflammatory processes or certain autoimmune, what do you call autoimmune conditions, that may lead to the, from the enlargement of the gland or the formation of a goiter, and not necessarily not necessarily iodine deficiency. So, and one of them is what we call the Hashimoto's, which is an autoimmune condition and affects the gland, and so as a compensatory mechanism, the body may stimulate the gland to enlarge, just so that it's able to produce hormones to meet the body's needs. Yeah. So.
But doctor, when you mention iodine deficiency, what exactly do you mean?
So iodine deficiency, like I said earlier on, iodine is a micronutrient which is found in food, and with the body, it's a micronutrient also contained, but we get it from food, and the body needs it. It's the main nutrient that is needed in the production and secretion of thyroxine, which is the hormone which the thyroid gland produces for the body's needs. So if it's deficient, it means that the body has inadequate stores of it, and typically it turns out to be a dietary deficiency.
So let's talk about treatment, doctor. Nanajo has already said that it's quite expensive down here, but when someone has that, what would you advise that they do, or what are some of the treatments that they can go through?
So it depends on what the problem is. If you have a goiter, enlargement of the gland, you may have an underfunction, or you may have an overfunction of the gland. If the gland is underfunctioning, then we need to replace whatever it is that the body needs, which the gland is unable to. So in which case, we would replace with what we call thyroxine. If it turns out that the gland is underfunctioning, is unable to produce this thyroxine which the body needs. The gland is overfunctioning, which can also happen in the case of a goiter, because like I said earlier on, it may just be a swelling without any problems until it either starts giving the mechanical problems. But you can have an underfunction of the gland and have an overfunction of the gland. If the gland is overfunctioning, then we need to give medications to suppress this overfunctioning. And then when that is done, the next option will be surgical, because once there's a swelling there, it needs to be taken out. And so most people would start with the medical treatment, and then we'll then follow with the surgical. So the modalities for treatment would include medications, either to treat the underfunction or the overfunction, and then surgical. There's also radioiodine, which is also a treatment modality where we use radioiodine it's the same iodine, but when we say radio, something which has the ability to emit rays, and then by so doing, it destroys the cells in the gland which have grown, just to deal with it. So those are some of the treatment modalities.
Nanajo, in wrapping up, tell us what projects your foundation is embarking on and how people can help you.
So, as I said earlier on, we are creating awareness. So by the awareness, we go to hospitals, and then we meet the thyroid patients on their clinic days. We talk to them on how to live their life, because even the medication that doctor has said, there are times you need to take it. We realize that the doctors can't do it all. So what we do is we talk to them, we tell them that when you are taking thyroxine, it has to be taken first thing in the morning on an empty stomach, so that your body will get enough metabolism to work well throughout the day. So we educate them on how they should take their medication. We tell them on their dietary issues, so what food is good for you, what you shouldn't be eating, and all that. And then currently what we are doing with, we're embarking on a walk to tell the general public about it, because there are a lot of people walking around with it, and some of them are scared. They don't want to even go. Like I had a surgery, you can see my scar there, and then somebody, they tell them you have to do a surgery, and they don't even show up at the clinic again. So we want them to know that there's we have able surgeons, able physicians out there
that can take care
of you. So don't be resulting in herbal medication, because herbal medicines, they make the situation worse.
So when is the walk?
The walk is this Saturday.
This Saturday.
Yes, and we are starting
August
from
24th.
Kolebu 24th. We are starting from Kolebu and walk around 8 environs, and then we'll end up at the 5th floor surgical to visit the patient who just had their surgery.
Right.
And also make a donation of blood pressure machines. Because some people who had their surgeries last month realized that they don't have adequate of it, so the foundation solicits for some few sponsorship to buy.
So is there a number that people can reach you on if they want to help in any way?
Yes. So we have 02076315553 and then 0243376304.
All right. Thank you very much. We've been talking about thyroid disorders, and Dr. Eugene-Tetteh Wayu has been our doctor, and Mrs. Nana Adjoa Kunedu is the president and founder of the Thyroid Ghana Foundation. And she says if you want to help them, help other people, you can definitely